sound right, did it? Well, here's the story about the fetus. In utero, there is a very elaborate bypass system that bypasses the fetal lungs, because really, you're breathing air, right? But the fetus isn't really. I mean, it's in this watery environment, right? It's getting all its oxygen and stuff care of mom, and it's being distributed to the developing baby through the baby's circulatory system. But the lungs, I mean, they're important, right? But they don't really need the same level of oxygenation as the newborn, or as we would. So there's this really interesting system of bypasses in the fetal heart. And a couple of these you've already, well, you were studying the heart last night, you know about them already. One, and this is the remnant of it, there's this little scar-like structure right here between the aortic arch and the pulmonary trunk, which the adult structure is called the ligamentum arteriosum. That's what this is. But the fetal structure is called the ductus arteriosus. And then here in the wall of the right atria, there's another little remnant scar in here, which is called the fossa ovalis, but it's open during fetal development, and it's called the foramen ovale. Now, the reason for these, and here's the picture, and it's a little hard to see on this one, so it's easier to see on this one. Well, let's do the first one, then we'll go to the second one. So we're not going to worry, because here's the placenta and the arteries and veins, no big deal, okay? We're not going to memorize any of that stuff, the liver and all this sort of stuff. All right, so here's baby's heart, right? And it's got the same 4 chambers, right? So, you know, it goes right and right, left and left. So here comes blood, and blood goes into the right atrium. Well, what happens in us, of course, is the tricuspid valve opens and it goes into the right ventricle, which happens in the baby. But really, what more importantly happens in the baby is, and you've all heard of this probably, there's a hole in the wall of the right atrium, which just passes blood straight across to the left atrium. In other words, basically bypassing the right ventricle, going off to the lungs, right? So it goes straight across into this side, which pumps it out into all the developing tissues, right? So we've got one bypass of the lung. But of course, some blood is going to get into here, and it's going to kind of go towards the lungs in its natural pathway. But there's another bypass right here, which is the ductus, which is this little, so you see how it would work? If this was open, this thing was open, the blood, instead of going out to the lungs, would short circuit straight into the aortic arch and then go out to all the tissues. So these two bypasses in the fetus direct the bulk of the blood to the developing tissues rather than to the lungs. Now clearly the lungs get some tissue, and of course, as you guys all know, one of the real critical issues with very premature infants is lung development. In the really tiny little babies that are just a few pounds that develop in the I mean, you've all seen these pictures. Sometimes later in life they do have some issues with lung development. So they're bypasses. So here's the bigger picture. So this is the hole, which just the stuff goes straight across. But at birth, this hole closes up. If it doesn't, then we have to have surgery to close it. And here's our other bypass right here, and this also closes off. And the remnant of it that you have right now is the ligamentum arteriosum. You have the remnant of this in your heart too, the fossa ovalis. Now, I assume sheep have this as well. I don't know. I've never looked. I actually found this. I told you I found this one time in a sheep. I've never ever looked for this. It may be there. I don't know. I'm not a coronary specialist for sheep, but I assume that it's there. So it's a pretty cool system where we actually have this bypass, this sort of fetal bypass that directs the blood to developing tissue. So I think that's pretty neat. Oh, okay. Well, here we go. So we should look at these. Now, I wish our cats looked like this. They might. Doubt it. Right? I mean, no offense meant to you guys. I'm saying that we'll be dying this way. All right, so now this is a trachea back here. Aortic arch. This is the only one brachiocephalic artery. So brachiocephalic artery comes up and it branches into the left common carotid, the right common carotid, and the right subclavian artery. The left subclavian artery comes off way down here by itself. So it's kind of like two branches. Like this is a tree here, and this is sort of like a shoot coming off to the side. Now, these are usually pretty good in our cats. They take a little cleaning to get cleaned up and stuff. These are the lungs over here. You can see they removed most of the thoracic, most of the ribs and things like that. So that's pretty good. A broader view, and these would be arteries. Some of these, of course, we're not looking for. So here's the aortic arch. Here comes the brachiocephalic. Here's the big branch. Here's the carotids. Here's the subclavian. Where we tend to have problems with both the arteries and the veins is when we get out here into the arms. Because for some reason or other, in many cats, the latex dye doesn't seem to penetrate very well. And so when you're out here looking for red and blue, sometimes it can be really tough. Okay? But basically, this is how it works. We'll do the subclavian because it's an easy one. Here's the right subclavian right here. And then it goes a little further and it just changes names. It becomes the axillary. And then it goes a little further and it changes names again. When it gets out in the arm, it becomes the brachial. It's all the same vessel. It's just its location dictates its name. It'll be the same on this side. So you can see to see these things, you need to carefully, I mean, you just can't get in there and start cutting away. You need to dissect. You need to find these. Now, this cat has been prepared in a way that I guess they basically removed all the veins, so you can just see the arteries. You're going to have them both on top of one another. Here's, well, this shows you the arteries and veins. Here, this would be, here's mesenterial 7, yes. Don't do that, but probably will. This is the inferior vena cava. This is the abdominal or descending aorta. Here's the renal arteries and veins. You can see this is the kidney. This is the ureter. This is a female cat because here's a uterine horn. Here's an ovary that they pinned off to the side. Here's part of the colon and stuff like that. This is all very nicely cleaned out, obviously. That would be the abdominal region. We look down here into the legs of the cat. It's really kind of interesting. The abdominal or descending aorta comes down and it splits again into sort of like a little tree. We have an external iliac and an internal iliac. The external is bigger and external, and there's the internal is deeper. And then it just kind of comes down and becomes the femoral. The veins do a similar kind of naming sort of thing. You'll see that in another picture. Oh, yeah, so this is a, well, this would be great. This is a really nice arm that's nicely dyed blue, and you can see that the arteries and the veins run right on top of one another. They have exactly the same names, they're just different colors. So hopefully that's what ours will look like. This one, the external jugular is always real obvious, and you never have any trouble finding it. The internal, for some reason or other, I don't know if it doesn't dye well or something, but it'll be interesting to see whether we see any tonight, because often we just, you know, out of 6 or 7 cats, sometimes we don't see any at all. Oh, and the other thing, and I don't understand this either, is it's not unusual at all in cats to see all kinds of weird abnormalities, so to speak. And it's very common in cats to see, down here in the kidneys, to see a renal artery, but for some reason or other, I know we'll probably see it in one of our cats in this group tonight or next week. It's not unusual to see 2 renal veins going into one kidney. I don't know why, but it's not unusual at all. And sometimes I've seen quite commonly the inferior vena cava, instead of coming down here and dividing, it divides way up here, and it's really can be like, what is that? Oh my gosh, that's it. Just I don't know. Don't ask me why, because I don't know why. It's the way it is. And anyway, that's what they look like. So that's a pretty good reference. I've got tons of reference